It's always tough to find a spot to jump in on Ayla Brooke and the Soundmen because I'd rather just let the song play. We'd rather just let the album play. A good Wednesday to you, friends. It's September 8th, and this episode of Real Talk is presented by our very good friends at Bitcoin Well, planet Earth's first publicly traded Bitcoin ATM company. As a matter of fact, I'm going to see Caleb at Bitcoin Well today. Got a couple questions, want to check in. They helped me with my Bitcoin wallet because, quite frankly, I don't know what the hell I'm doing.
Bitcoin wallet?
There's a Bitcoin wallet. Oh, yeah. Oh, it's a whole thing. There is so much to learn about it. And there's like real life, like actual tangible stuff you hold when it comes to Bitcoin that holds your Bitcoin that you can't hold. You get what I'm saying? No.
Not at all. Yeah.
I don't either. That's why I need Bitcoin Well. It's why you need them too. Questions answered, safe, convenient, secure, buying, selling, all of it. You can be found under the sponsors tab on our website, RyanJesperson.com.
Real Talk starts right now. Here's Ryan Jesperson.
Big show today. Looking forward to a conversation coming up. This is, as a matter of fact, tough subject matter. I don't mean tough, difficult. Like we're not talking about, childhood hunger, or we're not talking about something that sort of pains the heart. Hey, what about, it's kind of a bit of a tough conversation yesterday, but what a wonderful conversation with Julie Rohr, a good friend of the show who joined us. And I know that many of you have downloaded that podcast, have watched it on YouTube, and have been sharing the clip of it on social media. Not a tough conversation like that today, but our lead-off discussion today, and it's going to be in just a few minutes with Dr. Jennifer Jackson and author Jim Brophy, about abuse aimed at healthcare workers. It's a tough conversation because it's a conversation that is actually bringing out the worst in me. It's a scenario that's bringing out the worst in me. As a matter of fact, let me see if I can track this down. There was a tweet that I liked, and I'm kind of wondering if some people might come at me for this, saying, you shouldn't like a tweet like that, Ryan. It was well, you'll see what I'm talking about when I read it. But we referenced Jen, the feisty librarian, yesterday. She's a great follow. Give her a follow on Twitter at feisty_waters. And she tweeted, and there's going to be some adult words here, so earmuffs on the kids just for a second because I want to do the tweet justice. I'm a pretty non-violent person, but I swear to fucking God, if I ever encounter an asshole anti-vaxxer yelling at a patient or a doctor or anyone else trying to access a hospital, I will punch them in the neck so hard that it breaks my hand and hopefully their neck too. And I thought, yeah, I'm going to like that tweet. Because I don't want to quite come out and say that myself, but I swear... If I, and of course she says I'm a nonviolent person, and then what we'll say here is that we don't ever support punching anybody in the neck or the face or the body or anywhere else. But if I was going to punch somebody in the neck so hard that it would break my hand and maybe break their neck too, it would probably be an asshole anti-vaxxer demonstrating outside a hospital and without apologies. Because that's kind of where, and people say, wow, you're bringing some hostile energy like 4 or 5 minutes into the show today, Jespo. But the fact of the matter is, I think that that's where a lot of people are at right now. We lack the patience because everyone's tapped out. Everyone is exhausted. Everyone's not quite, can you say at the end of their rope, or is that something we can say anymore? We don't know where these euphemisms and phrases come from. I have this great book up on our bookshelf at home. It says, why do we say that? And it's a great dive into some of the language that we use. At the end of our rope. Do we even know what that means? Is it like a tug of war reference maybe? I don't know if healthcare workers are at the end of their rope yet because, and we take them for granted, let's be honest, because they just keep showing up and they just keep delivering. But I think if you're like me, and there may be varying stages of this feeling, there may be varying depths of the angst or the anger that people feel, but I have zero patience for people that are abusing healthcare workers in the middle of a pandemic, and I don't know how this has become part of our normal. Saw somebody yesterday saying, what has become of us now demonstrating and yelling at healthcare workers outside hospitals? You don't have to like the Prime Minister, but throwing rocks at the leader of the Liberal Party, Justin Trudeau, out on the campaign trail, really? Like, where are we at? Why are we here, and how did we get here? So I'm looking forward to this conversation with Dr. Jennifer Jackson and Jim Brophy. Jim's the author of Code White. We're going to find out what Code White means in just a second. A little bit later on in the show, as part of our ongoing federal election coverage, we've been making you a promise, and actually this is something that's really sort of been fulfilling to us, is a mandate to explore as many different angles as we possibly can on the federal election. So you'll be hearing different perspectives from across the country, from different people representing different communities or different demographics. And we want to make sure that our election coverage is as all-encompassing or as depth-driven as possible. And that includes today Indigenous perspectives on the federal election. The Grand Chief of the Treaty 8 First Nations of Alberta, Grand Chief Arthur Noskey, will make his return to Real Talk. And we're also going to be checking in with Nagan Sinclair, an Anishinaabe writer whose work has appeared. You may have seen him on Power and Politics, read his work in a number of different national, international publications, currently on sabbatical from the University of Manitoba. We're grateful that those two will join us. That's coming up in about 20 minutes or so. We'll take you out to Jasper today, courtesy of our friends at Tourism Jasper with MyJasper Memories. I'm going to be getting a little bit personal today and showing you some family photos from our recent trip out there, including a video you're going to want to see of a Stanley Cup champion, of a former National Hockey League captain, Andrew Ference, just nailing the Happy Gilmore Drive. I caught it on video. I was there. I witnessed it. It is an unbelievable highlight. We'll be sharing that with you today. And then in about an hour or so, maybe an hour and 20 minutes, we'll talk to Nick McCarthy from the Beechwood Cemetery as September 30th approaches. We're just about 3 weeks away. The National Day of Truth and Reconciliation, a really neat initiative. It's a mailbox of sorts at the National Cemetery of Canada. Not of sorts. It's a literal mailbox. And
literally.
It literally is a mailbox. And Canadians are invited. Well, can you tee this up for us, Sarah? Basically, Canadians are being invited to share their thoughts or their personal experiences on reconciliation on residential schools. It's kind of a bit of an open mandate. In other words, what's on your heart is what should go on paper, correct?
Absolutely, and it's addressed to Dr. Bryce, who is the whistleblower for residential schools. I mean, he was the first medical officer for Canada. He was actually appointed by Johnny MacDonald.
Wow, the architect of residential schools.
And so Dr. Bryce blew the whistle. He was silenced, but these letters are going to be, it's actually at his gravesite where the mailbox is. So,
wow. So we'll be providing the address, and of course we can tweet that out and stuff too.
Betcha.
People that are going to be listening to this on the podcast. And then Cindy Blackstock will be receiving these letters. She's been on the show before, of course, a remarkable person, executive director of the First Nations Child and Family Caring Society of Canada. And then we'll find out what they're going to do with these letters. I think it's a really neat initiative. We're going to get to some of your emails today to talk at ryanjesperson.com. We got a ton of them. Jaylene, we're reading yours. I'm going to get to Ben Plays Drums. Ben Plays Drums. His band played a gig recently, said, I've never been so uncomfortable in my life. Want to read that. And Colin was in touch with us, too, a letter to the Premier. He CC'd on this. We're getting a ton of correspondence. I know that yesterday a lot of people were surprised that Alberta didn't hear from its chief medical officer of health or its premier. 17 deaths, COVID-related deaths, 17 of them over the weekend. More than 1,000 new cases a day. I mean, these numbers are, appallingly familiar, let's say. It sort of feels, Sam, in a way like Groundhog Day. It feels like when we launched this show, you remember, like last November into December, January, and we were getting you to do all these graphics boards. You remember that? I mean, once you start getting into, quadruple digits, once you start getting into 1,000+ new cases a day, you get that feeling again, don't you?
You do. And it's like, I don't want to say history's repeating themselves, and I do want to say that, things are a little bit different now because there is just more vaccinated people out there in the ethos. But, I mean, at the same time, it is appalling to me that we just keep, like, it's the we never learn. You know what I mean? Like, that's the part that just grinds my gears.
There's a different dynamic, like you said, though, is that before, and we touched on this on the show yesterday, before it was everybody getting sick, or what I mean by that is that, COVID did not discriminate, and now the fact of the matter is that disproportionately the numbers of people that are hospitalized, people that are in the ICU, are people that are not vaccinated.
Well, and I mean, this circles right back to our conversation with Julie yesterday. It just these are preventable people for being in the ICU. Like, the big difference between then and now is every one of these unvaccinated people that ends up in the ICU had the choice to go prevent
or
this.
at least most of them.
Well, yeah, exactly.
We'll recognize that some people are in positions, and I don't want to let me be honest with you, and I'll make this commitment in the spirit of legitimate, informed, reputable dialogue, that I will not brush off the fact that some people cannot get vaccinated. That is a fact. And I do think that that's important to point out. So it's not simply the vaxxed versus the unvaxxed. But generally speaking, Sam, you're right. There are a lot of people that could have made that choice. We'll continue to have these conversations. We call the show Real Talk for a reason. Also want to make a quick note. We briefly touched on, one of my childhood heroes yesterday, Theron Fleury, who's just been kind of going sideways a little bit on social media as of late. And I tried to pick my comments carefully yesterday and show some respect and at the same time not pull punches where punches should be thrown and recognize just the lunacy of some of his recent comments. Well, Brandon University has released a statement today. Theron Fleury was the recipient of an honorary degree from Brandon University. And he was sort of showing that off over the weekend too. People were going, Theo, what are you talking about? He goes, well, I have a degree in this. And someone's like, what? Someone said, well, you have an honorary degree. He goes, well, it's the same thing, and it's from Brandon University. So Brandon University this morning is like, so we'll get into that statement in just a little bit. And I want to read this statement. I'm going to read it in its entirety because I think they wrote it in the same spirit. I mean, there's obviously a higher profile with bigger implications, a bit of a release than mine was yesterday. I'm just a hockey fan that idolized the guy. He's 5, 6, 7 years older than me, something like that. I remember him coming in as a rookie, mid-cup run in '89 for the Flames. And, I mean, everybody remembers Theo Fleury. They've used that celebration, him sliding on his knees, pumping his hands. I mean, that's been used on Hockey Night in Canada openers for years. The guy endeared himself to hockey fans everywhere. If you were an Oilers fan, you absolutely hated the guy. If you were a Flames fan, you adored the guy. But he's, as is oftentimes the case with celebrities, and most especially with a presence on social media, you get a peek behind the curtain and you see kind of what makes them tick. And I know that it's concerned the folks at Brandon University, so we'll get into that statement in just a little bit. We're going to talk about abuse in healthcare workers in 1 second. I want to remind you that this show happens because we have the support of amazing partners like the team at Westworld Computers. And right now, their Back to the Future sale is on. You can check out more at westworld.ca. When you buy a new Mac with Apple Care Plus at Westworld, they're going to give you up to $100 to spend on awesome accessories. If an iPad Pro, like the one I'm using, with Apple Care Plus is on your shopping list, $50 in instant savings on accessories when you buy in their store or online at westworld.ca. And don't forget, you can save hundreds of bucks when you trade up from your current Mac or iPad. You can learn all the details at westworld.ca. Also wanted to let you know how excited my wife Carrie and I are to be hosting a tailgate party coming up this weekend on Saturday, September 11th. We don't get to do this a lot, Carrie and I working together, hosting stuff together. We're really excited to meet a bunch of you. It's going to be a nice distanced event. We're obviously going to be outside, but you have a chance. The first 75 of you, by the way, that book private appointments, a chance to tour these beautiful show homes built by Daytona, Jamin, Landmark, and Pacesetter. You can learn more online at DeRoche.community, or you can follow me on Twitter and you'll see the sign-up link. Here's why you want to sign up. Not just because Friesen Brothers is going to be there with food and St. Albert Dodge is going to be there with the brand new Rams, and we're going to have live music and a whole ton of fun for the whole family, but the first 75 of you that book appointments to view these show homes, we're going to give each of you a 4-pack of tickets to go hit the football game later that night. Edmonton Elks, Calgary Stampeders, September 11th, 4 tickets in the Family Fun Zone to the first 75 people that show up. You can find the sign up, and I'll retweet that. Sarah, maybe you could even retweet it from the Real Talk RJ account. Make sure you follow that account on Twitter as well. It's The Villages at DeRoche Villages. Looking forward to this exciting event coming up on September 11th. Let's get into this. I don't have to tell you that there are protests. I mean, if I say across the country, I'm not sure if it's accurate or not, but they've been popping up. They've been popping up like zits on someone's back. You know what I'm saying? Absolutely disgusting demonstrations of anti-vax ideology and angst aimed at healthcare workers. Joining us this morning, Dr. Jennifer Jackson is an RN and an assistant professor in the Faculty of Nursing at the University of Calgary. She's got expertise in supporting nurses, improving health systems. She's currently focusing on community-based harm reduction services, and she's the co-author of a new piece in Nursing Open we're going to take a look at. Jim Brophy also joining us, a health researcher. He's got a PhD in occupational and environmental health. Jim is the author of Code White. To the both of you, thanks for being here. Really appreciate your availability on Real Talk. Jim, why don't we start with you? What's a Code White?
Well, a Code White, thank you, by the way, Ryan, for having us both on. A Code White is a signal, if you will, in a hospital, in a medical facility that alerts healthcare staff, security, that there is a violent incident at play going on. And it's used as a way of signaling that the healthcare workers need support and assistance.
How common is a Code White, Jennifer? Is this a phrase that every healthcare worker is aware of and knows about? Is this a commonly used phrase?
Absolutely. This is something that is almost a daily occurrence in the hospital, I would say. The last time I was there, it was happening at least daily. And we know for staff that work in hospitals, nurses face the most violence of any professional group. So nurses face more violence than police. Nurses face more violence than construction workers, any other group, you name it. Nurses have more dangerous incidents on their job. And I think that largely that's often overlooked because nursing is a majority female profession. And we have issues with addressing violence amongst women in society. And because the legacy of nursing is very female oriented, it kind of goes hand in hand with that. But when I worked clinically, like I've been kicked in the face. I've gotten a concussion from a patient and, all kinds of things. And I have had de-escalation training, nonviolent crisis intervention training, and all kinds of things. And it's just the nature of the work we do is very, very difficult, and it's not recognized.
Well, I'd be curious to get both your take on this. And I know, Jennifer, when you say it's the nature of the work that you do, I know you're not saying that in a way that justifies the scenario at all.
Of course not.
It comes with the territory, but but that doesn't mean it's not something that we need to address. And both of you have done a ton of advocacy on this, Jim, including your book. Is this the low watermark? What we're seeing right now? I mean, is this scraping the bottom of the barrel? These public demonstrations we're seeing outside hospitals, people targeting and abusing healthcare workers. Is this the worst you've ever seen it?
Well, I thought, by the way, that Jennifer summarized very well exactly the situation that healthcare workers are facing and have faced for some time. I think this is just making more graphic the targeting of healthcare workers and the crisis of our healthcare system, that you could have crowds demonstrating, stopping ambulances, assaulting healthcare workers, abusing, patients. This is really showing that the public, what has become a reality for healthcare workers. In our research, we found, for instance, that violence had become so prevalent, so widespread and normalized that it was simply considered as part of the job. And this, we were wondering, well, why don't we know about this? Like you were mentioning the demonstrations now, which are very graphic and public, but we're occupational health researchers. Margaret Keith and I, we've been involved in these issues for 40 years, and we were shocked by what we were hearing. And of course, the other part of this is that you have a work culture that breeds fear of reprisals, that healthcare workers are intimidated and threatened if they speak out publicly about what is happening to them in the work environment. So this has kept the public in the dark. And that's, I think, one of the major reasons why we wrote this book and why we just completed 3 major peer-reviewed studies on this issue and on the pandemic, is because the public needs to know that what is happening to healthcare workers is a bellwether for the crisis within our healthcare system. And until we address these major issues, the frustration that so many people in the public have toward the healthcare system will continue to fester and even get worse.
Yeah, I don't think that either of you will be surprised to know that we've even heard stories like firsthand from the horse's mouth from guests, healthcare professionals that have appeared on this show that have been recipients of abusive behavior based on their comments on this show alone, let alone more public or forums where they might be more accessible, in real life, walking into work, walking into hospitals. Now, of course, there are many reasons why this would be an issue of great concern. And Jim, you just teed this up nicely for us. Jennifer, I suppose one of them, of course, is a practical approach. It feels a little bit cold and calloused for me to say this. I don't mean to suggest that we're not worried about the nurses in particular or the healthcare workers in particular, but with regards to the health of the system and sustainable delivery, this sounds to me like this could be really problematic.
Absolutely. I mean, we have nurses who aren't able to work because of COVID, because of the physical and mental health knock-on effects of COVID. And so when you have people who are being threatened, being yelled at, it becomes that much worse. And I think that it demonstrates a broader, a lack of understanding of what healthcare professionals do and the risk that we incur as part of our work. And I think that I have seen violence in the hospital, and, it's never excusable or condonable, but there are times when I can understand, if someone is under the influence or they have something that's affecting their brain chemistry, they don't know where they are, they feel very threatened. We need to do emergency medical things to support them. I can understand that person who's maybe experiencing delusions being potentially violent. It's not okay, but it's understandable. The idea that there are people standing outside your workplace, potentially throwing things at you, screaming at you, when, prior to this, we had folks that were coming out every night at 7:00 to bang on pots and pans in support of healthcare workers. It's just completely unbelievable that there's been this kind of transition, and it adds a whole other level of threat to the daily work that nurses and other healthcare professionals do. And I'm afraid for my colleagues. I see that they're already experiencing incredible amounts of burnout, and burnout isn't even, I don't say that lightly. I mean, a very severe kind of physical and emotional exhaustion, which has been made worse by poor policy decisions that could have prevented some of these additional waves, additional ICU admissions. And then it really just reads like an extra kind of middle finger to the people who are trying to get us out of this. And we're all for political discussion and dissent, and, we shouldn't take things as status quo in society. But at the point where you're protesting a hospital, I really just have to question, what is going on?
Yeah, that's putting it politely, Jennifer, to say the least. Dr. Jennifer Jackson, Dr. Jim Brophy, our guests here. So Jim, you talked to, you spoke to more than 100 healthcare workers, right, in putting this book together? Personal support workers, nurses, aides, porters, clerical workers, cleaners, telling their firsthand accounts of what you might describe as nightmarish experiences. I would imagine at the same time, these folks probably had some suggestions or some insight into how Canadians could start to turn the tide here. And I know that people that hear this interview will be eager to know what they could do or what they could control, but I'd imagine there are systemic elements as well. Where do we need to start?
Well, that's a great question, and I'm not sure where to start, because we did hear many, not only stories of abuse and violence, sexual assault, racial abuse and assault, and as I think Jennifer mentioned, 85% of the healthcare workers are women, and you cannot help but see the parallel between violence against women in our society and what's happening in the healthcare system, including the way they are silenced and targeted and controlled in terms of speaking out publicly about this issue. But the healthcare workers that we talked to, and that wide range of people, told us about a whole series of improvements and steps that could be taken. Of course, everyone recognized that the underfunding of our system, the understaffing of our system, the lack of input that healthcare workers have, the horrible hierarchy that exists within a healthcare system that keeps the voices of those and nurses and PSWs and orderlies and cleaners and so on from ever participating in what's going on. And yet, if you listen to them, they have enormous suggestions, enormous numbers of suggestions that would prevent violence. And, we've known for decades that our system is horribly underfunded. Ontario has a lower ratio of nurses to patients than Mexico does. And it's been classic because we've had 20 or 30 years more of real neoliberal policy from the federal and the provincial government that both, Alberta, Ontario, Ottawa have turned a blind eye to this issue. They've allowed the system to continue to function in a way that provides an atmosphere, that creates an atmosphere where harm and violence can occur.
Jennifer, you co-authored a research article that was released just a few weeks ago, 25th of August, on Nursing Open, licensed practical nurses' perceptions of their work environments and their intention to stay, a cross-sectional study of 4 practice settings. Essentially, you're taking a look at, let me know if I'm dumbing it down too much, but basically whether or not LPNs want to still show up for work. Like, that's basically it, right? The impact that this is having on people's shorter and longer term sustainability or desire to keep showing up. I mean, if I'm a parent or a guidance counselor and I'm listening to this interview and I'm listening to a young man or a young woman that sits there and says, I've always dreamed of a career in nursing, I'm going to sit there and say, I'm not sure that that's a good call right now. But I don't imagine you're going to try to dissuade people out of nursing, because we need some of the most skilled and talented and empathetic people on planet Earth into that profession. So how do you sort this out? What would you say to those young people, those young potential professionals, the parents, the guidance counselors, and the like?
I've never regretted being a nurse a day in my life. It is the ultimate opportunity to make a difference in the world and support people, particularly at their most vulnerable. And also it's an act of problem solving and social justice in motion. And I think that's incredibly valuable. When we start addressing these issues, we can have kind of a hyper-local approach, but also look at the big picture. So the big picture is still that for women in every single country of the world, the most dangerous place for them to be is their own homes. And as long as there are endemic cultures of violence against women, we're going to see knock-on effects of that onto healthcare professionals and nurses. And I know that there are lots of male nurses and non-binary folks, other gender identities that are integral in our healthcare system. But the legacy of being a predominantly female profession is very, very relevant in this conversation. So I think we need to be talking about that level as well. In both my research and research done in this area for the last 20 years, we know that having adequate staffing and good leadership are integral to nurses staying at the current place where they work and in the profession more broadly. So, I mean, we need to be looking at aggressive measures to improve staffing, approaching bargaining, asking nurses to take a pay cut after COVID, which is probably the worst thing that has happened in modern nursing in terms of the impact on staff and for all people who work in healthcare. And, leading into bargaining, saying we want to reduce your pay. It's also not lost on me that the first place for cuts sort of post-pandemic, even though we're not post-pandemic, was a predominantly female profession. That matters here. And that is an issue because we know that these currents are still flowing very much under our policy discussions. The idea is that, well, nurses just kind of bring around some pills and pat people on the head, and it's the doctor that does the thinking and the real work. And, nothing could be further from the truth. Nurses are often the first people who raise the alarm when someone is starting to deteriorate. And they are the ones who mobilize the healthcare team to provide that emergency assistance. And so, valuing women and how we think about women and historically female professions does matter. I think there's also questions of funding. I know that healthcare can't be just a black hole that we shovel money into, but if we're really strategic about these resources in terms of saying, how are we going to ensure that we have adequate staffing? Can we provide, a leadership academy for all managers in healthcare, so that they are making sure that they have adequate resources? How can we, give people the most autonomy possible in terms of scheduling their shifts, arranging around childcare, providing a variety of options? And how can we look at the way nursing and healthcare professionals are respected in society? And I think that people always have a right to protest, but we really need to also say, if you have a relative that's one of those people doing it, maybe say like, a hospital, really, really a hospital. I think we need to, encourage people to take other kinds of actions that aren't endangering the safety of essential workers. So also, if you know a nurse on like a micro level, phone them and tell them that you appreciate them and that you're sorry that they're going through this, and maybe bring over a casserole, because everybody has really had a hard time. And it's important that those individual connections are just as significant as those that we're approaching on a societal level.
Jennifer, I'm so glad you said that. People taking 5 to 50 seconds out of their day to fire off a quick text to a healthcare worker, or in particular here, we're talking about nurses, to somebody they know, whether it's a respiratory tech or a paramedic or an orderly or whomever. I think it'd just be so huge. I'm not surprised. We've got a wonderfully diverse audience. I'm not surprised that we have nurses and retired nurses that are watching this live, that are chiming in on our live chat. AB says, every time we need around-the-clock security for an aggressive patient on our unit, AB says the hoops we have to go through with management to get it approved. Gina says, I know many nurses who are planning on walking away. It's just they don't see it as worth it. Michelle says, who could have imagined a few years ago that healthcare workers would be under attack from the very people whose lives they're working 16 hours a day to save? Michelle says, it's like we're in the twilight zone. I'm with Michelle on that. Somebody said the other day, it's unbelievable. It's anti-vaxxers outside the hospitals and it's anti-vaxxers in the hospitals. Really tough to wrap your mind around that. Some interesting comments here. Ken says, I've got 4 nurses in my family, 3 of them in one family, a mom and her 2 daughters. They never complain about their job. They never complain about the stress they've taken on or the sadness that they deal with on a daily basis. Ken says, my respect is immeasurable. We're hearing from other nurses that are chiming in. I don't have time to read them all, but Terry touched on the fact that Alberta is now bringing nurses in from out of province to just address basic staffing levels. Dr. Jackson, I see what you just did with your face. For people that are listening on the podcast that don't have the benefit of seeing that was worth 1,000 words, where's your head at on that?
Well, I mean, I have studied with some of the leading researchers in the world on this one, and it's really frustrating to see that this is government policy, because this is just such the wrong thing to do. So the UK introduced, I spent a lot of time there and I know their healthcare system very well. The UK introduced measures where they would pay agency nurses, which is what Alberta Health Services is proposing, to pay agency nurses $50 to $75 an hour to come in and fill gaps. And we do need mechanisms to fill gaps in our systems. But by leaning into having agency nurses coming in more than an occasional capacity, when it's looking at filling a substantial proportion of our staffing needs, that's very problematic, because then you have one nurse who is working, who might be making $35 an hour, and the nurse next to them doing exactly the same job is making $75 an hour, where is the incentive to stay at that hospital and not join the agency yourself? Then what ends up happening is that you can have a unit that is staffed largely by agency folks. And so you lose that local knowledge. So the idea of like, how was Mrs. Jackson 2 days ago? I don't know. I'm here from an agency and I don't know, how things were going 2 days ago. Where's that piece of equipment for that rare and specialized thing that we only do a couple of times a year? There's no, local knowledge and local expertise to know how to handle those situations. So agency staff can have a role for nurses that like a lot of flexibility and want to, try working in different places. So that in itself is not a bad thing, but the idea that we're going to offer reductions or freeze in nursing pay for the vast majority of Alberta nurses, but bring in other staff at $75 an hour just doesn't make any sense. And we've seen, other Western healthcare systems, it's ended up creating these really dangerous dynamics within the wards when you have a lot of agency staff that are very capable, but don't have that local knowledge and that local expertise. So instead, a place to start would not be cutting nursing pay. We need to be supporting nursing salaries so that there's enough incentive that people want to take those permanent jobs and attend work at the same place every day, and to have a culture at that workplace that draws people in rather than pushes them out. So I think that it's a bit of a short-sighted approach to try and fill gaps with agency staff when what we need to be doing is improving the workplace conditions and paying nurses at rates that they deserve.
Before
Can
I think,
just say,
of course,
Brian,
yeah.
I just want to say that in a certain way, of course, I agree with everything that Jennifer has said. Unfortunately, nurses are voting with their feet now, and they're walking away from the trauma, the burnout, the crisis that they faced through the pandemic. But I think that this bringing in agency nurses makes a lot of sense if your intention is to erode and privatize the healthcare system. This is exactly what is going on 1,000 levels every day. And I just want to mention before we leave that, the elephant in the room here is what's happened in Canada with our long-term care facilities, where the violence is even more pronounced, and where, in polls that were done on, nurses and personal support workers, almost 90% of them experience violence, harassment, sexual and racial abuse on a weekly basis. When we did our study, the title of our study was Breaking Point. This is before the pandemic. And so, when it's reported in the Lancet that we have a national disgrace, a national disgrace because of what's happened in our long-term care facilities, it shouldn't have been a surprise, because the conditions were such that workers were literally thinking, how can I get out of here? People with, 20, 25 years were quitting of seniority in these positions because they had given up a sense that they can care for people. And at the same time, the majority of the long-term care facilities are in private hands, for profit hands. So it's in the face of our public health system that we all as Canadians, cherish. So I think this is one of the things we need to be mindful of when we're talking about the steps that governments are taking. They are not protecting our public health care system. They are not protecting the healthcare workers in those facilities. They are allowing them to erode and go to private hands. And this is creating and fueling the crisis that we're now in.
Dr. Brophy, I'm glad you brought that up. If people are just hearing this interview and aren't as familiar with Real Talk as maybe others, I want to remind people that back on August 5th, we had a really powerful conversation about long-term care in Canada with Dr. Vivian Stamatopoulos. You can find that either via our podcast or, of course, on YouTube as well. That's the August 5th show. So let me ask you this in closing, both of you. I'd like you to chime in on this because I know that we're about Dr. Jackson, about, I think, 9 days away, September 17th. is a planned day of action. I don't know if day of action, if that's sort of a euphemism for a strike, if that's what that is. I've always sort of had mixed feelings about strikes. Sometimes you sort of say, well, these workers have got to a point where they've either been locked out or they've walked, whether it's wildcat or not, a scenario where they're trying to grab the public's attention. They want to force the hand of the employer, or they feel like they're not being treated fairly around the boardroom, or whatever the case may be. But strikes aren't always positive experiences, right? Like, you don't always win public favor when you strike. And you sort of wonder if it's, to a point where it's regrettable or unfortunate that nurses or other healthcare workers have to be in this position. Where are your thoughts at as September 17th approaches? Jennifer, maybe we'll start with you.
I fully support nurses taking job action because I think they have every right to stand up for themselves. And at this point, if not a strike now, then when? I should say clearly that I'm not a member of the union that is proposing the strike, nor I'm a neutral party on this. I'm not affiliated with Alberta Health Services either. But to go through the experiences that nurses have been through, and, there have been significant numbers of people trying to advocate, whether it's through campaigns of writing to your MLAs, whether it's through professional pressure. Nurses are very engaged politically at a national level and a provincial level. The Canadian Nurses Association has put out its calls to action for the coming election. So we are doing the things that would hopefully fill that space. And when that's not working and the issues have escalated to the point where people are feeling fearful of even walking into their jobs, I look at this situation and say, kind of, what else is there? I certainly hope a strike can be avoided. It's not a good thing for people in hospitals. It's not a good experience for the people who are striking. But I think that some of those salary proposals that were put in place during the negotiations are frankly just disrespectful and offensive to say that towards, after 3 waves, we're going to cut your wages because balancing the budget is that significant a priority. I just really understand people's frustrations. And I would ask everybody watching to say, you know what, use your political power. We have municipal elections and federal elections coming up. Nurses are having a day of action on September the 17th. Stand with them. Contact your elected officials and say, I'm not okay with this. And, in addition to reaching out to nurses or other healthcare professionals that yourself, take that tweeting rage that you were referring to earlier in the program and channel that into things that that can help hopefully make some changes. We had a federal party leader say that he was okay with privatization and there was scope for that within our healthcare system. And, we need to take note of these things and vote in response to that.
I don't want to even, I'm not going to put this, I want to put this out in the universe, Jim, but it's obvious, when we're talking about a day of action, when we're talking about strike action, at the same time, we're talking about demonstrations outside hospitals. It just, to me, you get the feeling that there's a bit of a powder keg potential there, and it makes me nervous, quite frankly. Where's your head at on it?
Well, I think there is a powder keg out there. I think it's inside the hospitals. We've had healthcare workers living through this unbelievable pandemic, risking their lives every day to go to work. Let's not forget that they were denied the most basic levels of protection for many months. In fact, in Ontario, it took, going into court by the nurses union, by the Ontario Council of Hospital Unions, to even get the proper respirators that the previous SARS commission had recommended that the government be stockpiling. So, you have situations now inside these hospitals where the level of demoralization, the trauma, the emotional anxiety that people are facing, it needs to be brought out in the public, because let's not forget that they're not allowed to speak out about this. When you keep this completely, under closed wraps, that you don't allow people to have a voice, that you mute their experience, it's going to show up, because the resistance to this kind of conditions just requires they take bold action. And frankly, for me, I applaud them. We need a wake-up call about what is happening in our healthcare system. And if the nurses are going to lead that, that makes a lot of sense to me. I know that the Ontario Council of Hospital Unions has been very much on this as well. This has got to be a very big bullhorn that's out to the public that our healthcare system is in crisis. And if we don't address this, the consequences will be more privatization, more violence, more hospital shutdowns, more long-term care scandals. We have to come to grips with what's in front of us. And the choices is not just that we have to put, we have to continue to go in debt or so on. I mean, I hate to put it this way, but what about all the subsidies that we give the fossil fuel industry or the auto industry or the banking industry? Why aren't we taxing the people that have the wealth, that have the resources, so that we can have a public healthcare system that really works? And we deserve one. That's what our parents fought for. That's our grandparents fought for. And it's too precious for any of us to allow this kind of thing to go on. So I applaud the nurses. I wish them well. I will stand with them virtually. But I think whatever action they're taking, and I don't think it's particularly a strike they're talking, although they may be. I think it's more of a day of action where they'll be out on the street corners, out in front of the hospitals, not necessarily on strike, but calling public attention. And so, and my very last point, if you're going to call and say, something to nurses, ask them if they, or healthcare workers, ask them if they have any experience with violence. And I dare say you will not find one that can't tell you a story about this. And we should say to them, this is not acceptable. We do not support this.
Dr. Jim Brophy's book is Code White. His PhD in occupational and environmental health, Dr. Jennifer Jackson, an RN and an assistant professor in the Faculty of Nursing at the University of Calgary. I'm grateful for both of your insights this morning. Really invaluable. Thanks for taking the time.
Thank you, Ryan.
Thank you.
Thank you, Jennifer.
And the live chat, Kimberly was another nurse. Kimberly, thank you. Gina, thank you. Thanks to everybody that's been chiming in, talking about your personal experiences. Kimberly says, people say as a healthcare worker, you chose your profession, abuse comes with the territory. Kimberly says, no. I chose to help others at vulnerable points in their lives. I didn't choose to be a punching bag, which is well said. Man, there's a lot of people with, I mean, this is, Chad says, this is called an information pick. I should be careful. I don't want to be irresponsible and start using the word strike. Strike is a supercharged word. It's a day of action. And that's coming up on September 17th. So we'll see what that is. I'm just like, am I wrong to put that out into the universe? I'm like nervous right now. We see, and I know that these are maybe, the gravel throwing incident at Justin Trudeau. People might say, well, that's an isolated incident, but these protests that are popping up in cities across Canada, outside hospitals, sometimes you hear words come out of your mouth and you're like, are we seriously talking about this? Are we seriously talking about protests outside freaking hospitals? And obviously there'll be a police presence when and wherever this happens, but I would just hate to see clashes. And worst case scenario, thank a healthcare worker today is what I'm getting at. That's the most important point. Sarah's keeping an eye on our hashtag, a great way to chime in both during our live show or if you're joining us later in the day. Thanks to those of you that download, that subscribe to the show, wherever you get your podcasts or you find us on YouTube. Of course, Real Talk RJ, our hashtag is powered by the team at Park Power. The team at Park Power at parkpower.ca has a great incentive for you to bring over your electricity, natural gas, and internet. The promo code 2021-REAL-TALK gets you $70 off your first bill. And here's the deal. They're also a company that takes 10% of their profits on the electricity side and puts them right back into the nonprofits and the communities where their employees live and work. One of the coolest parts about it, if you've been on their website, you know you have an opportunity to designate where you'd like the charitable donation to go. They've got a big, long list of charities that qualify. You can find them online at parkpower.ca. Also wanted to remind you that the team at Local Waste is gearing up for another edition of Trash Talk. That's coming up this Friday on the show. You can send us your emails to talk@ryanjesperson.com. Keep it local with Local Waste, construction, commercial, and residential waste and recycling collection. You can find them doing business in Alberta and Saskatchewan. Again, online at localwaste.ca. And a big shout out to the team at Eden Landscaping. They're bringing outdoor spaces to life and have been doing so for more than 20 years. Mike and his team. This is the thing. They've got these teams that they can dispatch that do these big, beautiful jobs, but when you deal with the company, you're getting that one-on-one attention where every detail is covered. From the design all the way through to the construction, they don't quit until you're satisfied. Mike told me personally, I've shared it with you before, he's most proud of their problem solving. Whether you have that one nasty spot in the yard that has a drainage issue or that one spot in the garden that's just not happening, they've got great ideas on how you can transform that outdoor space and truly bring it to life with Eden Landscaping. We'll be talking to Grand Chief Arthur Noskey and Nigon Sinclair. In just a moment, we're going to get Indigenous perspectives on the federal election. I'm looking forward to that conversation, but wanted to briefly touch on somewhat of a remarkable statement released this morning from Brandon University. Theron Fleury, a former National Hockey League All-Star, of course, a Stanley Cup champion with the Calgary Flames, an Olympic gold medalist, has a pretty prominent online presence, and on Twitter over the past number of days has been pushing out nothing shy of conspiracy theories, suggesting as one example that vaccine passports would allow pedophiles to know where your kids are at all times. It certainly earned Mr. Fleury some criticism. He responded to one in particular by noting that he's the recipient of a degree from Brandon University, of course, an honorary degree. It prompted the university yesterday afternoon to release this, quote, Brandon University steadfast in our support of academic freedom, academic inquiry, and robust public debate around issues of consequence. These freedoms, however, must be balanced against responsibilities like honesty, integrity, and good faith. We're disappointed that honorary degree recipient Theo Fleury is increasingly not meeting that balance. In 2015, Brandon University presented Fleury with an honorary doctorate, recognizing his significant contributions to combating child sexual abuse and for his efforts at that time to promote healing and recovery. Fleury, a survivor of sexual abuse in his youth, was one of those key voices exposing sexual predation in junior hockey, and he continues to deserve both praise and understanding for that role. We kind of touched on that yesterday here on the show. The statement goes on. More recently, Fleury's turned his voice to launching personal and political attacks and to the espousing of conspiracy theories. Over the weekend, he shared a reprehensible statement falsely linking vaccine passports to pedophilia, and he responded to criticism by brandishing a screenshot highlighting several of his past awards, including his honorary degree from BU, obviously prompting the statement. They say honorary degrees are awarded by Brandon University to recognize an individual's significant achievements or contributions. They are not academic credentials. Fleury's significant contributions to exposing the rot in junior hockey and to supporting the other survivors of child sexual abuse through recovery continue to deserve respect. It's understandable that he may struggle to trust authority and that he may see dark motives in others' actions. His recent statements, however, go beyond reasonable distrust and are a stain on his legacy, which saddens us. This is pretty remarkable for a university to be writing this. A stain on his legacy. It saddens us. I mean, this is, for with regards to what are typically benign statements, this is far from benign. It goes on to read one of the tragedies of abuse. And we alluded to this yesterday. One of the tragedies of abuse is how it perpetuates itself across generations. We call on Fleury to recognize that he's now a person in a position of authority, and to recognize that his actions as an authority put him in a place where he can cause harm to others. And we hope that he takes advantage of the resources at his disposal and seeks greater understanding of the science behind the pandemic and the essential public health role of vaccines. That from Brandon University. That statement released just yesterday, September 7th. They didn't rescind, they didn't pull it. They didn't pull the honorary doctorate, at least not yet, which would have been, I think, quite a statement.
I think that's really, like, the spirit of that, though, is really beautiful in that they're saying, we're concerned. This is not okay. We invite you. We ask you to please reconsider your comments. We're not going to pull the honorary doctorate yet. But, you know, red flag.
Yeah. And this is, and that was kind of the balance I was trying to find yesterday where I said, like, listen, now, it's different when you say I loved this guy. I mean, what I'm talking about is the adulation of a hockey fan. It's fleeting. It's surface. You know, you can cheer a player one year and the next year he's an overpaid bum. We know that sports fans are fickle. So I don't know that I ever loved Theoren Fleury like I love my family. But I sure liked him a lot. I liked him as a hockey player. I grew up in Calgary. He's one of the greatest all-time Calgary Flames. He's easily in the top 5. But it's been difficult lately. It's been difficult to watch. And I found myself from time to time trying to extend the benefit of the doubt because you never know. This is a guy that's battled alcoholism. He's worn his heart on his sleeve. He's participated in a couple of books. In a theatrical production of his life that was touring the country just like 2 years ago. I mean, this is recent history. He's a guy that has earned a ton of public sympathy. His history with that absolute monster, Graham James, you know, alongside Sheldon Kennedy and others. I mean, Theoren Fleury has encountered so much trauma in his life. And so you don't want to come on, I didn't want to come on Real Talk yesterday nor today and say, you see, this guy's absolutely losing it, start poking fun at him, making a joke. It's not funny at all. As a matter of fact, there's nothing funny about it. It's tragic. And I thought it was pretty remarkable that Brian, and I'm not surprised because Fleury was brandishing that, like, I have a doctorate from Brandon University. I have a degree. I can talk about this stuff. They're going, these are not academic credentials. I'm curious for your thoughts on this. You can send us an email anytime to talk@ryanjesperson.com, or, of course, you know where to find us on Twitter. You can follow us at Real Talk RJ, and, of course, you can also participate in the live chat. You know, I mean, a lot of you were saying, like, Hope says this is certainly a warning to Fleury. If he keeps yapping, Brandon University will pull that honorary doctorate. If I know Fleury, and I don't know him well at all, I've interviewed him 5 or 6 times. We played hockey a couple times. I wouldn't say I know him. But I don't think he'd give a rip to have that honorary doctorate pulled if it meant that he felt he was being muzzled to prevent it from happening. If you watched him play hockey, you know how he approaches scenarios. I mean, this is a guy that was a foot shorter than everybody else and would just go into the corners and scrap anybody, and he just is wired a little bit differently because he probably had to be to survive, quite frankly. Lisa says there's absolutely right. She says there's nothing funny about this. It's serious and it's tragic. Terry says people who love him need to get him help. And I like this from Wigwith. This is a good insight. Who says, you know, it's kind of nice that Brandon University worded it like they did. It's sort of almost like a friend as opposed to an attack. Says, but it's really sad. I know many think that they're finding legit stuff online when they're sharing things like that, like a vaccine passport, giving pedophiles clues into where your kids are at. Like, you know, we dismiss these things and say, oh, why don't you tighten your tinfoil hat? But the fact of the matter is it resonates with some people. And oftentimes these are the same people. I mean, there's this common thread, isn't it? These are the people that are outside hospitals. These are the people yelling at nurses and doctors. It's the same crew. It's the same people throwing gravel at the prime minister. It's the same people pulling all these kinds of stunts. We'll continue to talk about it as part of our mandate. Let's move on here. It's a federal election looms, all right? Fewer than 2 weeks. On September 20th, Canadians will go to the polls. And we've made a commitment to you to approach our coverage of this from as many different angles as possible. Today, I'm looking forward to a conversation with the Grand Chief of Treaty 8 First Nations of Alberta, Grand Chief Arthur Noskey, who's agreed to join us to provide an Indigenous perspective on this. Grand Chief, thanks for your patience as we got things lined up technically behind the scenes. It's great to have you back on Real Talk. How have you been holding up?
So far, so good, Ryan. Thank you.
What's on your mind, forefront? I mean, we'll talk about Treaty 8. I want to note right out of the gates, in no way, shape, or form are we presenting your perspective as the perspective of every Indigenous person across this country. Obviously, there are different priorities. There are different perspectives based on geography, circumstance, and otherwise. But with regards to you personally, what are some of the most important election issues, ones that you're prioritizing or keeping an eye on?
I think in the area for us as Treaty 8, Ryan, it's the party platforms, right? I know elections come and go, basically parliament changes, the electorate changes, but for us in this federal election, the timing, we couldn't agree to the timing basically as to the issues that were surfacing in relation to the IRS stuff, right? But in saying that, I believe that the priority is what are the changes basically in the party platforms. I'm questioning that, that the next parliament will address the issues of First Nations that are, across Canada.
There was a release out of the sovereign nations of Treaty 8. I want to ask you about this, and for the benefit of our audience members that didn't have a chance to read it, I want to read just a portion from it. We, the sovereign nations of Treaty 8, call on federal leaders to provide a firm action plan outlining how Indigenous issues will be addressed after the election. This election is acting as a distraction to the real issues facing Indigenous peoples. We're tired of hearing the same rhetoric at every federal election. Party leaders attempt to solicit votes from Indigenous peoples with promises that are never acted upon, much like the treaty promises. The government needs to stop making empty promises and legitimize our nationhood. It's pretty direct. Let's get into what that looks like. Where do you start?
Well, again, it's going back to the election promises every time, right? So the seriousness, I believe for us is, where is it on the party platform? Usually on a party platform, Indigenous nations is just a one-liner. We'll do this for Indigenous peoples, and that's the end of it. So, when a push comes to shove for governments that are, the parties that are in government, they revert back to the party platform. So in saying that, where are the changes on the party platforms that basically will bring that significant, change in how Indigenous issues are going to be addressed? And if it's not there, then, we'll expect only the same, I guess. Status quo for me, I guess, would be the outcome of whoever gets elected. So in saying that, then the purpose of that is I went to the blinding light walk last 12 kilometers to Parliament Hill with Chief Byrne from Chip Prairie. And there is Caucasian people walking with us and asking, two questions they asked was, where are the changes in the Indian Act that needs to happen basically for that, the Indigenous issues are front and center in eliminating not only the poverty, but also the suppressive government policy. And the other question was, who do you want us to vote for? So basically my answer was, well, I'm not here to tell anybody to tell them who to vote for. But the significance for us would be looking at what are their party platforms on addressing the Indigenous issues that are front and center today.
Okay, so I know you don't want to tell people who to vote for, but have you seen anything of substance, anything that's catching your attention that you believe to be viable or meaningful or sincere in any of the party platforms? And if so, where are you finding it?
Now, not that I know with the party platforms, I haven't seen anything. Basically, the issues front and center today are basically the economy and also the COVID-19. And the concern is in the healthcare where the cuts are happening, right? With the pandemic in full bloom, basically, again, the fourth wave coming on. Yes, these are front and center as to where the priority and where the issues need to happen, change, or because it impacts everybody. But when it comes down to, kind of like when I guess the prevailing storm had subsided a bit, where and how do we address reconciliation and restitution for our people? Because as a sovereign people that entered into treaty, we did not give up the land. We agreed to share it with the settlers, and that is, I believe, all across Canada from treaties 1 to 11. So we need again, when push comes to shove for the party that's in parliament, they usually revert back to the party platform. So in order for us to see that they are serious about addressing the current issues with Indigenous peoples, we need that wording in a party platform, not just a one-liner, maybe a whole paragraph as to what their commitment is to, in bringing about change with our people.
I agree with your assessment that there's a lot of talk about the economy, that there's, obviously talk of COVID-19. I'm not sure that there's been that focused of a discussion, though, when it comes to this campaign trail. If you look at what the general public's talking about, some bizarre diversions on things that are quite frankly meaningless. I'm talking about issues like abortion that in my mind, when that flares up, it just seems so disingenuous, oftentimes from the people flinging the mud and the people that are receiving it. I mean, Two Beaver is chiming in, says climate is the only issue. Hawes says, hey, listen, if they're not talking about doing away with, or let me say abolishing the Indian Act, then they ain't serious about Indigenous issues, says Hawes, in my humble opinion. Would you concur? Would you like to see something as bold as a definitive statement, we will abolish the Indian Act?
I guess in saying that, like a commitment to abolishing the ones that are suppressive and basically restrictive on First Nations. And, right now, like I watch the news occasionally, and it's Indigenous candidates. Basically, they're, taking pictures with the Indigenous candidates and, oh yeah, we're doing it, addressing Indigenous issues and going forward. I guess to those Indigenous candidates out there, that I would question that. Basically, if the party platform does not change in their position and how they're going to address the issues going forward, then what is your Indigenousness in Parliament going to do, right? Is it just basically, bringing the knowledge and the experience, or kind of keeping addressing the issues? Or can there be significant change outside party platform positioning? That'd be my question.
Do you, I get this sense, I feel it's been, how do I describe this groundswell across the country? It started outside, as if I need to tell you, Grand Chief, and you've been available on this show before for very candid and meaningful commentary, but outside the former Kamloops Indian Residential School, these 215 unmarked graves, and then, of course, these heartbreaking announcements, these numbers across the country in Cowessess First Nation and so many others. And the nation, this was right around Canada Day, right? And a lot of people grappled. We had our question of the week around it. Are you observing Canada Day? Are you not? There's a house right by us that's flown a Canadian flag for years, and they're now flying an orange silk outside their home. My young boy, he just entered grade 1, and we show up for the first day of school the other day, and there's orange ticker tape tied all across the chain link fence. It's a very powerful visual. The country is talking about it, although like with anything else, and I hate to say it, but it's just a fact, like anything else, it starts to fall out of the news cycle, doesn't it? It was leading the headlines every single night, every single morning for weeks. And I sit there and I wonder, if not now, there's a federal election right now. There's a federal election just a few months after 215 unmarked graves were discovered near Kamloops. It is just within a few months. If not now, then when?
Yeah, I guess that's the question we're asking as well. And, in saying that, just doing the walk and seeing, Caucasian people, women, crying and applauding our position in addressing the atrocities of the past, they could relate. I'll say that they related to us. And I believe that, when it comes down to, ground zero, I guess, as a human being, the only way that you can really capitalize on relating to what our people went through is basically when you have your own children, young children. Like imagine a 3-year-old and a 4-year-old being taken out of your hands and into a total stranger. I don't think anybody would be open to that. And at that time, our people that entered into a treaty, education and healthcare were the 2 top priorities. So they thought that they were going to get educated. And that is where basically, the atrocities happened. And so much shame was in those schools that the kids could not communicate to their parents, even though when they came back. So with the voters, I guess, across Canada come September 20th, if there's anything I would like to say, on these campaign trails is where and how does your party platform change in order for the significance of addressing the Indigenous issues and the history of the residential schools? Where is that wording in the positioning? Because if it's not there, then I don't think any change will happen. And in saying that, they committed to funding, but now they're on caretaker mode, so nobody can talk or address anything, right? So all they can talk about is their party platform, that we will do this, but I think with the significance of those words, if they're on paper and written, then yes, we'll believe it. But until then, it's just like a rhetoric, I guess you can say. Thank you.
Yeah, I think this statement is so powerful, again, from Sovereign Nations of Treaty 8. I want to read another portion of it. Quote, "We continue to feel the pain of the atrocities done to our people under the guise of Canada's legislation, the Indian Act, and residential schools. Every day, our people and communities deal with the complex, long-lasting effects of intergenerational trauma. We will no longer stand by as the federal government avoids accountability in their role of genocide and the deliberate, systemic mass murders of our people." It's strong wording. When you demand concrete action, when you want to see specific wording. We talk about abolishing the Indian Act, and that's one thing, but when you talk about things like intergenerational trauma or the effects of trauma, it can manifest itself in different ways, and so can some of the solutions or the funding commitments or what have you, right? We can talk about things like affordable housing. We can talk about supports for people who use drugs. We can talk about inner city funding for programs and for young learners and for children in schools and education and infrastructure. There are so many different angles that you can approach this through the lens of what we're talking about. Would you agree?
Yeah, I agree. And there is an areas that you can address in going forward, I guess. But the critical piece for me is like this. I think I addressed it last time, where our people, like I keep hearing the comment there, well, it's been 80 to 100 years, get over it.
Yeah.
And the stories that I came across recently was the one that the grandpa, right, talking about having kids, having grandkids, having great grandkids, and then realizing that he was emotionally unattached to his family. So it's that those are the residual effects that are there. So when we start talking about restitution, where are those helps? Where are those institutions within the Treaty 8 territory that our people can go to, like the public can go to? And just recently, I was in a golf tournament, a fundraiser for first responders, and I was sharing the stories there, and I can't say the name of the individual that said that, but we get so caught up in what our job is that we fail to attach our emotional being, like our human beingness, I guess, into our work. That is a lot of times we're so I guess conformed to the policy and the procedures of what we need to do that we leave our compassion and emotion behind for others. And I believe that to date, when it comes to Indigenous people, that has been the government that's been in Parliament all these years. And people that cannot relate, to the grassroots issues, people that cannot relate to, the suffering and the poverty, they don't understand. So, and I believe, these campaign trails are going to these big centers where there's a whole bunch of voters and they're all publicized, they're on national TV. Maybe some of them should start going to the First Nations reserves, with the boil water advisories, the dirt roads, the lack of housing, because the residential school system is still in effect under the provincial child welfare policies, because they are still moving children out of the homes, out of reserves, because of lack of housing, because of the poverty that's there. So, we need some substantial change that there. And the Indian Act is basically the document, like we addressed the doctrine of discovery last time. It's basically that's where the Indian Act derived from.
If you're just tuning in, if you're streaming our audio live on the Mixlr audio app, we're talking to the Grand Chief Arthur Noskey of the Treaty 8 First Nations of Alberta. A while ago, I had the honor of speaking with Chief Cadmus Delorme out of the Cowessess First Nation in Saskatchewan, and they had just recently announced an arrangement, a deal, whatever you want to call it, with the federal government that essentially provided sovereignty in a sense. I recognize that's a big word with regards to the implications, but essentially the Cowessess First Nations is taking over Child and Family Services as a sovereign First Nation, and he was excited about that. People can reference that interview in its entirety, of course. Is that what you envision? I mean, when you take a look, I mean, obviously you'll probably want to speak on behalf of Treaty 8 First Nations, but your perspective, 10 years from now, let's say 5 years from now, with regards to sovereignty on things like Child and Family Services, maybe even justice, law enforcement, what have you, community leadership. What does it look like? As you look into the future, what does it look like?
Well, I believe with the nations from Treaty 8 sovereign nations, we are looking for the child welfare legislation that we create for the well-being of our children, nurturing and a compassionate caring, and basically the availability of education and housing within that legislation if it needs to go there. C-92 currently from the federal government, works alongside the provincial governments, and the wording on it has to be compatible to the provincial child welfare acts. In saying that, at the provincial child welfare act, basically there's a director there that has a final say on where the children goes, where the child goes, basically, for instance. So in saying that, we basically, from the First Nations perspective, we would, I look at it many times as a kukum law, right? Of our caring, nurturing elders, it's usually the grandma that always considerate, that are always wise, and this storm too will pass. But when it comes down to their grandchildren, they're always thinking of the best of it. So the best future and best current for their grandchildren. So in saying that final decision, whether a kid is taken out of reserve and placed into a different nationality home outside of the community, that is still the residential school system in place, and that is where the Provincial Child Welfare Act is still applied to date. It's still in effect. So in saying that, our laws from a sovereign perspective will be for the best and well-being of that child. It's got to be staying within not only our culture, but also our nationality as a people. And it's in relation to our connection to the land. Because I'll say this, and I said it time and time again, there is a place that I know I am accepted. I know I belong, and I know how to get by. And that is basically out on the land.
Grand Chief, it's always such an honor to have you available to speak with us and to be able to glean your perspective on this. And you are certainly a priority interview for us as this federal election approaches. Thanks for your time this morning. It's great to have you back on the show.
Thank you, Ryan.
That's
Pleasure. Thank you.
Grand Chief Arthur Noskey of the Treaty 8 First Nations of Alberta. It's just the way that things go. It doesn't mean that it's cool. It doesn't mean that it makes sense, but the news cycle is just so unforgiving when it comes to sustained coverage of issues that really matter. I mean, not to take one out of left field, but like, when's the last time anybody talked about violence in the Gaza Strip? When's the last time anybody talked about Israel and Palestine? When's the last time that anybody talked about the IPCC report on climate change that was like a damning and like red flags waving all over the place? When's the last time people talked about it? The news cycle just churns. I mean, but it blows my mind that if we look back to mid to late June into July, where people were wrestling, I mean, that was as mentioned, that was our Y Station question of the week. Like, what are your plans around Canada Day? And you'll remember, I mean, that was, I won't say an audience divided. As a matter of fact, to me, I was quite encouraged by the results of that, because I don't think that there was I'm going to go on there. I don't think that there was a right or wrong answer. I do think it was the wrong answer to be like unabashedly, like painting your face red and white and like rolling around and blasting off fireworks and completely sort of disregarding or disrespecting where the national conversation was at that time. And I didn't begrudge anybody for also recognizing that July 1st has been a significant day in Canada, and people have their own feelings on that. And our audience indicated that. You indicated that. Hundreds and hundreds of you chimed in on that. And I don't remember off the top of my head, but it was something like 40% intended to celebrate, and 35% kind of had feelings like 20% where it was one of these kind of scenarios. But really, and this is even on us a little bit. It's on us a little bit with regards to the conversations that we've been having with guests as part of our coverage of this federal election campaign. How many questions have I asked our political experts and consultants and strategists and commentators about Indigenous issues or issues important to Indigenous people in Canada or First Nations communities? I fall short a little bit on that one.
But isn't that, for you to be able to say that and be reflective on that and say, okay, well, I'm going to recommit myself, and we'll make sure that we do that. But also, we booked with the Grand Chief.
Yeah.
And so instead of having, white folk talk about what are Indigenous issues, actually going to the folks to actually, hear their perspective. But I think I think it's a very valid point, and I say that, we will recommit ourselves.
Yeah, and I think this is important, but, bigger picture, the answer is always, it's always the same answer. Why isn't a political party doing this? Why aren't politicians? It's always the same answer. Because it would be politically unpopular. And I'm sure that in a war room, or I'm sure that as senior strategists and chiefs of staff and campaign managers sit around a table and say, should we commit to abolishing the Indian Act? I would imagine it's a pretty quick conversation. Right? I mean, when it comes down to the brass tacks of winning or losing an election, I'm not saying this is my personal opinion, that it's politically unpopular, so you shouldn't pursue it. But from a political strategy standpoint, just from X's and O's on the whiteboard, the game plan, it's obviously been determined by the teams driving the Conservative and Liberal and NDP and other campaigns that you're not going to win an election by committing to taking meaningful action on some of these conversations that Canadians and Indigenous people in Canada have been having, right? I mean, I think I can say that's a fact, because if they did think that it would be politically popular, they'd be doing it. You can let us know what you think about this interview. I didn't see what's going on. I saw that a fight broke out on our live chat, and then did you see what happened? They ended up apologizing to each other. These people that I'm pretty sure don't know each other in person. Someone said, I came at you a little heavy. Other audience member says, you don't have to apologize to me. It's all good. I'm like, what is happening in this live chat? It's the nicest hallway in the internet. It is it's like, for the most part.
Yeah, I mean,
I saw somebody taking runs at Nancy Pelosi earlier today, which I thought we're not really talking about Nancy Pelosi, are we today?
they came in left pretty
That's
pretty
okay.
quickly. Yeah.
Hey, I let you know. Every once in a while, we'll welcome somebody new into that chat that wants to drive some conversation on things that might surprise us just a little bit. But I just want to say my heart was full seeing. I was going to say the word reconciliation. I'm not, no pun intended there or no reference intended, but, people reconciling with one another and keeping it civil. Thank you for that. It sets the tone for how we want the show to go. We're going to continue a conversation about this mailbox that's been set up at the National Cemetery of Canada. It's the Beechwood Cemetery in Ottawa, Ontario, a mailbox at the grave of Dr. Peter Bryce, who blew the whistle more than 100 years ago, about 115 years ago or so, on the state of residential schools in Canada. That's coming up right now, though. It is our pleasure every single Wednesday. Here's a breather from some of the stuff, the real life stuff that we must grapple with, and we promise that we'll continue to do so, but every once in a while we need a break. In partnership with Tourism Jasper, every Wednesday, we're so proud to present MyJasper Memories. And it's an opportunity for us to refresh, take a deep breath of that virtual mountain air. And the team at Tourism Jasper does an amazing job of providing us with resources to be able to tell these incredible stories, the rich Indigenous history of the land that we know now as Jasper National Park. Some of the movers and shakers, the people that on the tourism front or the guiding front that have really made an impact in this part of the world over the past 100 years or so. But I want to get personal today. We took some time off. Family and I were able to head out to Jasper. And I just wanted to share some of my Jasper memories with you, to take you through our trip, so to speak. And so humor me here as I take you out first to the Fairmont Jasper Park Lodge. The famed tee box on 14. It's one of the signature holes of the Stanley Thompson designed course, and I was so lucky and so honored to host Tee Up for Tots. You can see, of course, Stanley Cup champ Andrew Ference was there. An amazing group of people that played the number one rated resort golf course in the country. My main man, Moses, our boxer, was there with me for a little bit. He's not supposed to be on the fairway, but every once in a while, we got to let his paws feel that. I mean, that's some of the best, most manicured fairway in the country.
It would feel pretty dang good on those paws.
I did keep him out of the sand traps. We kept it classy. I wanted to share this with you. Can we we'll roll this video? I'm not going to roll the audio because there's some spicy language from one of the spectators, but here's Andrew Ference. If you're listening to this on the podcast, you can watch the video. I tweeted it out just a couple of weekends ago. Here he is with the Happy Gilmore approach to a drive. This is on 18. This is the tee box on 18. Look at this guy. My friend Sarah Chan saw this and she left a comment. Look at this swing. That is not easy to do. It's at like 280 with the Happy Gilmore. He actually hit it onto the other fairway. That's how far he hit it. No, it's not a joke.
What's the Happy Gilmore?
Yeah, the Happy Gilmore. So Sarah Chan says, he's good at things that he's not even good at. So that was the greatest way to characterize his performance on the golf course. I had never been out on a raft. Shame on me. 44 years of age, grew up in this province, and I'd never rafted the Athabasca River. So we spent some time there. An absolutely amazing experience. We watched an osprey fishing, swooping down. I mean, just a beautiful experience. And, of course, surrounded by Mount Edith Cavell and Old Man and all the other mountain landmarks that you come to know. The guide there, just remarkable. I'd also never, I'm embarrassed to say, but I made it right. We made it right. As you can see by the photo there, we finally got our butts out to Spirit Island on Maligne Lake. Took the boat out there, the Maligne Lake boat tour. I would recommend it to anybody. Such a wonderful way to spend a couple of hours. What a stunning scenario. They call that the Hall of the Gods. It's like cathedral of mountains. And we learned, the guide did such a remarkable job. She's talking about the Indigenous history of why Spirit Island is considered to be so sacred. You know, you can't tread on it. You can't walk on Spirit Island. You respect it as a sacred place for ceremony. And Indigenous people have recently started returning after somewhat of it's a difficult history. The story of Canada's national parks, warts and all. And I was so grateful that our guide took that head on. And in our boat, there was a wonderful conversation. She was taking questions from these 5 and 6 and 7-year-old kids. They were asking questions about why First Nations had not been in the area for a while and what it meant for them to return. And I just thought it was such an amazing learning opportunity. These people, just this captive audience on this boat. I never met the guide before, and I was proud of her. And then there's the food. I wanted to show, I know that, here's Jasper Brewing Company. Don't worry, the 6-year-old didn't actually get into the pint, but Wyatt's eyes were wide. His mom and I are both very well aware we have our hands full 8 to 10 years from now. We know that. Had a chance to check out at the Pine Bungalows. There's this new restaurant called Kumama. That's duck that I had there, and it's it might be the best restaurant in Jasper. Kumama had an unbelievable dining experience there. We checked out the Moline Lake Wilderness Kitchen. I finally got out there. Their baked onion soup is the Jespo recommendation for the day. And then, of course, Evil Dave's, the Jasper institution. Sam, your 2 thumbs up on Evil Dave's?
Oh, you got to stop at Evil Dave's.
They're in their new
100%.
location now. Hey, they moved. They shut down for a while. They moved across town. And they've got this beautiful new location. We had a wonderful experience there, all in an amazing opportunity to recharge our batteries, to refresh. If you want to see those photos, of course, you can follow me on Instagram at Ryan Jesperson. I hashtagged MyJasper, which is what we invite you to do as well. We want to see your photos. We want to see your videos. Hashtag MyJasper and Real Talk RJ. And, of course, if you want to learn more about Jasper, we're so proud to partner with them. You can check them out online. It's jasper.travel/real talk. You can see some of our past features, learn more about what probably is. I'm going to say it. I'm going to say probably because you should always have an asterisk on these, but I think it's the most beautiful part of the country. That's what I think. And, of course, this is presented each and every week by our friends at Tourism Jasper. Well, we spoke about Dr. Peter Bryce on the show. His name has popped up several times as we've been having these conversations about reconciliation. Very difficult conversations, obviously based on, I will say, recent revelations about residential schools, though I always want to pick my words carefully because, elders, residential school survivors have been telling these stories and trying to get Canadians' attention for decades. How many of us knew the name Dr. Peter Bryce 2 years ago? It was in 1907 that Dr. Bryce released a report on the treatment of Indigenous children and the appalling conditions at residential schools across Canada. And now, in honor of the first National Day for Truth and Reconciliation, Orange Shirt Day, on September 30th, the National Cemetery of Canada, it's the Beechwood Cemetery in Ottawa, is inviting people to share letters of reconciliation, actual physical written letters to be mailed that will arrive at a mailbox that sits at the grave of Dr. Peter Bryce. Nick McCarthy, kind enough to join us from Beechwood Cemetery this morning. Nick, welcome to Real Talk, and thanks for making time for us today.
Oh, well, thanks for having me. Really appreciate the opportunity. I'm just going to center myself properly now.
No problem.
Really appreciate the opportunity for connecting.
This is a really neat initiative. Can you give us the backstory on how this came about?
So it happened kind of organically, right? When we're talking about Peter Henderson Bryce, I realize I'm not centered. He's somebody who's, sorry about that.
Don't worry about it. We'll get you centered.
Here we go. He's somebody who's this figure that was forgotten, right? And we've noticed we have a lot of events, Indigenous-related events at Beechwood where he's the focal point. And what happens is we've noticed that people leave messages, leave stones, leave pieces of art, and as you would imagine, it rains. So we decided that maybe it's time that somebody who's been passed away for almost 100 years gets a mailbox to be able to protect his mail.
Have you started receiving letters already?
So I've emptied it about 3 times already. And then we're receiving letters in the mail as well that go directly to our office. So I get them in my pigeon box. But what we did is we're hoping to publish kind of a book, right? There is a series of history books written by this gentleman called Broadfoot. And Broadfoot wrote a whole bunch of the history of like the West. And it was through conversations with people. And it was essentially just, he was explaining the conversation in his book. So we're really hoping to be able to publish these letters with permission from the family, of course. We're hoping to publish these letters and produce a book so that Canadians can see it and understand the impact of somebody who was essentially forgotten in history. And that's when we talk about reconciliation. We're not talking about sort of destroying Canada's history. We're talking about adding that aspect to history that we've forgotten about.
Yeah, the whole idea about destroying or erasing history, that actually, quite frankly, drives me absolutely crazy, those conversations, because it's not something that happens. And I think it's a misinterpretation of the entire exercise. Yeah. But can you take us into, I mean, I would imagine you have the opportunity to literally open these envelopes and to read these letters. What types of things are people saying?
So some of the messages are messages of thank you, right? Or why weren't people connecting with this report? Why weren't people actually understanding what happened, right? So when we look at Bryce, right, he releases a report in 1907 to somebody that he knew. And he knew Duncan Campbell Scott personally. They went to church together. And so we have a lot of people that are sort of questioning that. How can sort of the good intentions of people not have seen this issue? And we have a lot of people who would have lost, a lot of non-Indigenous Canadians would have lost children in the same type of manner, right? The same type of diseases. And so a lot of the letters are reflective of that. We have letters from Indigenous community that are saying thank you. And it's great that we're finally sort of accepting what Bryce wrote about 110 years ago, right? So I think that's the real message that we're getting. We're getting this idea that people are sharing their thoughts and sharing their hopes and sharing the fact that people are excited for to move forward and have these conversations.
Isn't it? I don't have anything profound to offer here, Nick. This is a general observation. But one of the reasons why I think that this is so impressive and so encouraging and so important, you can imagine, this Dr. Bryce writing this report in 1907, and it really is a remarkable report, and he paid for it, didn't he? I mean, I'll ask you to sort of provide us with some history, but he paid for it. And well, I just wanted to say, so he releases this report in 1907. Residential schools continued to operate in Canada into the 1990s, like 80 plus years after that. And you just wonder. I mean, you just wonder what it may mean or have meant to him to know that, 114 years later, that Canadians en masse, thousands of people, I would expect, ultimately, are going to be writing these letters and talking about the impact of his work and the impact of the courage that he showed and the plain language that he expressed about his very real concerns here. But it took more than a century.
Well, I think the problem is that when you look at the history of residential schools, and this is something that we're having this dialogue quite a bit at Beechwood, you can imagine being in Ottawa, we have a lot of politicians buried in our cemetery, right? And especially a lot of the early leaders of Canadian history. So when we look at these politicians, we can sort of ascertain what they've done. And somebody like Duncan Campbell Scott, he coined that he actually wanted to see a full genocide of Indigenous people, right? He's the one who really sort of looked to assimilate, but also get rid of the Indigenous problem. Of course, he used more specific words. But when we're talking about him, we're also talking about somebody who lost his own daughter to the same type of disease overseas. So he sends his own daughter. So where's that connection that people could have with their own lives to what's going on with Indigenous people? But when we talk specifically about Bryce, what makes him so interesting is in 1907, he releases this report, hands it to Duncan Campbell Scott. They went to church together. They were in the same congregation, like 3 benches apart from each other, right? Both same background, same education. Granted, Dr. Peter Henderson Bryce was kind of slightly more educated because he was a doctor. But once he released that report, he got sent into fisheries. And you can imagine fisheries in Ottawa is not a big portfolio in 1907. And we don't have a lot of open sea, as you would imagine. But he got sent to that. And then eventually he releases the report with his own money, publishes it with a publishing house. It gets released. It gets a lot of play, but the government then buries him. And they kick him out of the public service, and he's essentially left alone and destitute, loses his son, who was also a doctor, who also died in residential schools as part of his work within residential schools. So had they applied the recommendations that Peter Henderson Bryce did, his son wouldn't have succumbed to the same diseases that would have killed the Indigenous children.
I didn't know that about his son. Hey, there's a lot I don't know, though. Nick, which is why I think these are so important.
But I think just that, right? I think it's just we were never taught, right? It's not something that we were explained. Like you were talking about residential schools going on into the 90s. I was in school, and members of the Indigenous community were in residential schools at the same time as I was in grade school. So it's like we haven't learned that history yet because it was never shared. In French Canada or French Canadian schooling, you have Mariette Bourgeois, who was the nun that gave the Indigenous children candy in order to get them to come to school every day. And that's the story of the residential school done through the lens of the Catholic Church, right? This happy nun sharing candy and the little Indigenous children coming willingly, but it wasn't really willing at all. And so it's that sanitization that we were taught that we're starting to eliminate, right? We're starting to see that what the true stories are. And to say that somebody like Peter Henderson Bryce has been saying it, he's been saying it for 100 years, just no one's been open enough to listen.
Yeah, Nick, to keep it real, though, we're still seeing some of that sanitization. We're still seeing some of the justification. 100%. I mean, we're still seeing comments. We played video on this show just about a month ago from a Catholic, I don't know if he's a priest or a bishop or whatever he was, but in the province of Alberta, standing up at the pulpit and calling essentially calling residential school survivors liars that were saying what they were saying for money. We hear people saying they weren't all bad. There were people that meant well. I mean, all that. I mean, it's still happening to this day. Yeah.
And I think when you look at the legacy of the residential school, right, we partnered with this group called 7 Generations, Assembly of 7 Generations, and it is 7 generations of residential schools. You have the residential school system, then you have the 60s scoop, and now you have the millennial scoop, and it's all the product of the same institutional racism or the same institutional government supremacy over Indigenous people. We have to sort of take a look at how we treat Indigenous people on a regular basis from a policy level, right? You were talking about the Indian Act and the importance of abolishing it. And I think there's a discussion there that needs to happen, and somebody has to be courageous enough to say, wait a minute, it's time to actually have this conversation.
So you're inviting people to write these letters of reconciliation.
Yeah.
Talking about why reconciliation matters to them. Obviously, these are going to be very personal expressions, or I mean, they'll vary, won't they? That's the beauty of it. Yeah. You know, what have you learned about residential schools? What's your personal commitment to truth and reconciliation? Let's put the information up so people can send these. You can address your letter to Dr. Peter Henderson Bryce, to Dr. Peter Bryce, care of Beechwood Cemetery. It's at 280 Beechwood Avenue in Ottawa, Ontario, and the postal code there, K1L8A6. But care of Beechwood Cemetery, 280 Beechwood Avenue in Ottawa, Ontario. Obviously, I'm imagining you'd like to see them arrive before September 30th.
Ideally, right? On September 30th, we've closed down the cemetery, right? As a company, we think it's important to have a commitment towards reconciliation. So we're hoping to have, I would love to sort of see massive bags full of letters ready to sort of peruse and sort of share. So as I said, we've had quite a bit of letters so far, but I think it's when people are thinking about reconciliation, it's how can they live it in their lives? How can they connect with it in a meaningful way? And I think this is a simple way to do it and have that reflection and to write an old-fashioned letter, because we're all emails and social media, and I'm from the age of social media, so I've written maybe 3 letters in my life. But when we ask people to write letters, it's taking that time and having that reflection and see how it influences you, but what your own personal commitment. And it can be just something as simple as just accepting the truth of it all, right? And you mentioned the Catholic priest and at the pulpit, and it's something that people need to hear, and it's something people that need to accept as a truth. You may not agree with it, but it's their experience, and the Indigenous community has proven time and time again that their cries have gone unheard.
Yeah, we just had a conversation with Treaty 8 Grand Chief Arthur Noskey about that exact thing. Nick, this is a really neat initiative. Is this, by the way, is this the first time that there's ever been this sort of initiative, like with regards to mailboxes at prominent grave sites?
So, to my knowledge, there's never been a letterbox put on a headstone before.
Huh.
So I think this is a first. And hey, if we're going to celebrate Dr. Peter Henderson Bryce, I think what a great way, and what a great way to start a mailbox program for those who've passed away.
Is it going to stay there? Is the mailbox, is that like a permanent installation or no?
I think it's going to end up being a permanent installation. Yeah. We have a partner, Dr. Cindy Blackstock, and sort of she keeps adding stuff to the grave. And I think it's a great way for people just to connect. There's a couple plaques around too that people can learn about the legacy of Peter Henderson Bryce, as well as take one of our many tours. So it's one of those things, and it's about just being honest, right? And being open to this new information.
Nick McCarthy, out of Beechwood Cemetery in Ottawa, Ontario. It's the National Cemetery of Canada, 280 Beechwood Avenue in Ottawa. Thanks for making time for us. This is a really neat story. Appreciate it.
So thank you for having me.
Yeah, you bet. I'm going to commit to writing a letter. I'm going to do it. And not just to try to make it into the book, but I feel like it's important to put things down on paper. You know, this is like just an aside. This is a pointless and pithy little detail, but you ever sat down to write a letter recently? I don't know about the two of you, but, you know, muscle memory and our hands are conditioned to type or text. It's actually exhausting. It's physically exhausting to write a full page. Have you actually, like, I don't have the muscle there anymore. Remember back in the day, you know, he says he grew up in the digital age. He says he's written 3 letters in his life. I cannot relate to that because I used to be a big-time letter writer. My family, we used to have a tradition on Fridays. It was called Others First. And my parents would bring out these, these like little sort of rubber. My mom was always extremely well organized here, and you'd have like cards and stationery and letters and stamps and markers and pens and pencils. And we started at a very young age writing notes of appreciation to people, whether it was neighbors or people halfway around the world or what have you. And that was a tradition that kind of extended. My cousin Andrew, they moved to Malaysia in our grade 12 year, and Andrew and I used to handwrite each other letters because there was no such thing as email, kids, in those days. But there was nothing like going to the mailbox and getting a letter. Big deal.
Still is. I love getting mail. And
handwritten mails.
Yeah, postcards, anything. The wild thing is kids are not learning cursive anymore. So they're not actually learning how to handwrite. It's not part of lessons anymore.
Do they need to? You don't look convinced, Sam, that kids need to learn cursive.
I've had this debate with my better half, Kelly, a couple of times, because I was very firmly in the camp. It's just like cursive isn't really a useful skill anymore, and she's like, "Well, people need to learn to read cursive to be able to interpret historical documents. Like we need that skill at least baked into our psyche in order to understand history." And I was like, "Oh, I did not think of that."
Yeah, I wrote one of my nephews a card, and you know, I just kind of switched back and forth between cursive and printing, and he couldn't read it. Could not read it. He was like, "What is this?" I'm like, that's handwriting.
Although if I had to sit down right now, I mean, I could handwrite. I still would have the skill. I'd have the ability to do it, but I don't remember. I mean,
it's so much faster, though.
I remember, but not for me.
Printing is like you have to do each letter individually, whereas cursive...
Yeah, I guess. I mean, I'm also the son of a doctor. Doctors have famously...
Right. Who cares?
If my dad works really hard, he can actually have really nice penmanship. But I've seen like scripts, they call them like the prescription sheets and things. They're like, what the hell is this? These doctors, oh my goodness. But yeah, I don't know. I don't know if actually I'm going to consider this. In many areas, I'm in the gray. I don't believe this is an issue of black and white. The importance of cursive. I'm also not a curriculum developer, nor am I an educator. I don't know if I believe that cursive is an important skill or not. Kelly's point is a really interesting one. Interpreting or reading historical documents, although how many, like, not to take away from it, because it is a good point, but how many times have you had to do that, or how many times have you actually done that?
Not often.
Not often.
I mean, historians, I'm sure, would beg to differ on that one. And like, to be fair, interpreting, I mean, if you're a researcher, if you're a historian, if you're somebody that is always immersed in trying to understand the past, it's probably a much more useful skill to you than for, you know, someone like me that scribbles down notes during a talk show and mostly types.
Yeah, exactly. I don't remember the exact day or the moment, but making a transition off when it became, because the school I attended, my elementary and junior high school, was a pretty strict school. And I think transitioning from cursive into block printing, which is how I print with all capital letters, I remember that being somewhat of a controversial move.
You're such a rebel.
I was a rebel.
You're wild.
I got sent to the office once for not wearing socks.
You're wild, Jesperson.
They were like, you know, they're like, all of a sudden, all the kids are going to think it's okay to not wear socks. Had to take a letter home, get it signed by my parents that I had shown up without socks on.
I'll throw one more at you. In engineering school, you have to learn how to do perfect block type, all caps, because you have to be able to write blueprints. So
and
there is
blueprints.
penmanship courses that you have to take in engineering.
I'm not actually surprised at that, because blueprints, they're when they're done, they're actually beautiful.
Yeah, handwritten blueprints are immaculate.
Like architects, engineers, they're actually immaculate. You're right, Sam. That's such a great point. Online, people are saying, you know, it's Michelle says it's great for fine motor control, learning cursive, which is kind of interesting. Everybody's talking about hybrids. Some random guy says, to be fair, I can't even read my own printing. Kitty Jerkface, which is one of the better handles we see. Kitty Jerkface. I mean, self-assigned. We didn't assign that name. Kitty Jerkface does a hybrid. Chad says, my writing's a hybrid, but I love cursive. Miranda wonders, well, how are people going to sign the back of their credit card or their bank card or anything to sign? I mean, is your signature cursive? Not really. Signature, well, I guess maybe it is in a way. Mine's just a stylized swoop.
Yeah.
The Stylized Swoop. That's a great band name. Stylized Swoop.
Or a Chatterbox handle.
Yeah. Tracy says, I do not know an elementary school child who is not learning cursive. In other words, they're still teaching it. Miranda says her daughter learned in grade 5. Oh, James. Now, here's an example. James says, it's been several years since I hand wrote a condolence letter to a former head of a charity I was in charge of, and it took me forever, but he truly appreciated it. Like, so if you want to kind of class it up and write cursive, I mean, you think back in the day, my grandma Doris, she had pen pals for more than 70 years. Like, not like, oh, she had a whole bunch of pen pals over 7 years. No, she kept in touch with the same people in some circumstances, and they would meet in person. I think if I remember correctly, one of them lived in Australia, I think. I wish I could remember more. But she would show me these letters that she kept through the years, and that previous generation, the penmanship was stunning, like immaculate. And that would even, I mean, I loved seeing my grandparents' handwriting. I now keep little notes. I have a note in my toolbox. You would appreciate this, Ev. I have a note in my toolbox attached to a tiny little screwdriver, and it's my grandma's handwriting saying, and it just says, this screwdriver is to tighten eyeglass frames. But it's handwritten in my grandma's handwriting, so I will keep it until the day I die. Someone's penmanship, someone's handwriting, especially when you find a note or you're not expecting to, boy, does that really resonate, right? I love this. People are chiming in on this. This is like the most engaged the audience has been. Escher says, I'm jealous of modern kids. I hated learning cursive in school, but at the same time, I'm glad that I did. Fatima wonders if cursive classes will be replaced with courses on emojis. Maybe.
That's not totally out there.
It's how, like, when I'm cutting to the chase on texting somebody back and I want to, let them know my initial, response and
What's
respond
up?
quick, couple emojis, right? Like the 3 fires or the 2 fist pounds or, the smiling face with the sunglasses on it.
Mine is the teeth, where it's like,
yeah.
That's one of my faves.
That's a misinterpreted one, or an oft misinterpreted one.
Yeah.
Because I've always thought it's like, same as you.
Yeah.
Like a little bit, oh my gosh, sorry about that. I forgot to send you this. But some people perceive that as angry. I sent it to a buddy. He's like, why so mad, bro? I was like, mad?
Mad is the red. See, this is why you need the class.
Yes.
This is why you need the class.
James says he's kept all his handwritten notes from his dad, who's been gone for 20 years. James, absolutely treasure those, as you know. Mike says, try reading your Italian grandmother's writing in the recipe book. It makes you work for that pasta sauce. I love this. I love it. Thanks, everybody. Hey, I've got a really good news story to share from our friends at the Dairy Queens of Northwest Edmonton in Sherwood Park. I asked for their permission to share this number, and they said, all right, for the month of August, we reminded you that every child matters and every cone counts at the Dairy Queens in Palisades, Nemeo, Newcastle, Westmount, Y Gardens, and Baseline Road. All 6 of those locations had agreed to take $1 from the sale of every ice cream cone through the month of August and donate it to the Wekutuin Society that's doing amazing work, empowering women that are survivors of both residential schools and cancer, if you can imagine. Get this, Real Talkers. You showed up en masse to the Dairy Queens in Northwest Edmonton and Sherwood Park through the month of August, meaning these 6 Dairy Queens raised a total of $22,778. That's right. You bought almost 23,000 ice cream cones in the month of August at these 6 Dairy Queens. They're so thrilled to be presenting that check to an organization doing such important work, and I could not be more proud of Mark and Michelle and Michael and the ownership group of those 6 Dairy Queens. I'm going to be there at the check presentation at the Newcastle Dairy Queen coming up on September 18th. If you want to hang out with us there at 11 o'clock, we'll crush a few dilly bars and talk about, you know what I love about this is that, it's Dairy Queen, and Dairy Queen, people have fun at Dairy Queen. People love Dairy Queen. Doesn't mean we can't have serious and meaningful conversations. Doesn't mean we can't impact change. Doesn't mean that we can't support community members. And I absolutely love what they did there. So a huge shout out to the teams at Dairy Queen there. We're really proud to partner with you. And again, we'll see you there on September 18th. The teams at St. Albert and Sherwood Dodge, it was my pleasure to swing by the dealership in St. Albert yesterday. It's still pretty much brand. It still has that new dealership smell. Hey, you know what I'm talking about. You walk into a new dealership smell. Well, they've got the new Rams in there. They've got the new Jeep Grand Cherokee L in there. That's the one with the third row of seating. It's brand new this year. It is beautiful. I said to Brad, the GM, so you're going to get me in one of those brand new Grand Cherokees? He's like, buddy, we can't keep them on the floor. Everybody wants these Grand Cherokees. You're not getting one of these ones. If you want to see it, though, if you want to talk about getting your hands on the most trusted SUV brand since 1941, you know where to find them. In Sherwood Park, in St. Albert at Sherwood and St. Albert Dodge Jeep, and of course online under the sponsors tab at ryanjesperson.com. Also, a big shout out to our friends at Friesen Brothers. I was telling you about those Hatch chilies that they had in a while ago. Absolutely stunning. They elevated our last barbecue. You throw them on the grill. They're like bell peppers from Hatch, New Mexico. They're not super hot. Really beautiful on salads. People are putting them in their sandwiches with that famous Friesen Brothers sourdough. This is just one other way that Friesen Brothers is elevating the culinary experience. And of course, they're big on supporting local, too. They've built their brand on Alberta-grown, Alberta-owned for more than 65 years in 16 communities, including that beautiful brand new store in South Edmonton. When you're there, let them know you heard about them on Real Talk. Again, you can find out more at friesen.com. Now, I promised that we'd be reading some of your emails today. You send these to us to talk at ryanjesperson.com, and we always appreciate hearing from you. Jaylene was in touch, and she said, I live in Mackenzie County. Said it's easily located. Just look for the big gray square in the top left-hand corner on the government's vaccine rate map. Vaccine uptake here has been abysmally low, and misinformation is high. Says the Premier, Jason Kenney, visited a town in our county back on August 10th and 11th for their annual rodeo. And an acquaintance of mine attended that rodeo and said that the Premier was walking around apologizing to business owners for restrictions and forced closures when businesses, quite frankly, just weren't observing them, weren't abiding by them. And he was promising that this government would not bring in any more restrictions. Now, since then, he's obviously brought back weak restrictions, but in this context, they seem to make sense. A mask mandate. But what about schools? No mask mandate there. What about worship services receiving these exemptions? And what about bars closing at 10 p.m., says Jaylene? These would not have an impact on our extremely religious community with no such establishments. But I'll tell you, she says, the base is mad. Those with power and influence have said that Jason Kenney will not be reelectable in this region nor across the province. And it's extremely worrisome because it's clear that the Premier will wait until schools, businesses, and most importantly, healthcare services are pushed to the brink before he does anything meaningful. It's like what we were talking about yesterday in my opening monologue about this maddening trend where people have to absolutely lose their minds before the government will listen. Jaylene says, I think it's important that people know about this political fuckery, especially that the Premier was already making promises to people in an attempt to regain their votes while the fourth wave was clearly ramping up and alarm bells were sounding. That from Jaylene. We got this one from Ben. Ben Plays Drums is his handle. Says, I'm a musician and I recently played a gig at the Ponoka Stampede. Says, I'm a veteran musician, and I've never been so uncomfortable at a gig in my life. There were a few hundred people in the venue, unmasked, with no social distancing. A couple of big shutter doors open for airflow, but that was about it. Ben says, now I'm double vaxxed, but still mostly I stayed backstage with the band. We're all vaccinated, but when I masked up to walk across the room to grab a beer, I've never received so many dirty looks in my life just for wearing a mask. Ben says the bartender didn't even really acknowledge me when I tried to place my order. Somebody actually confronted me in the bathroom about my mask, but I just went about washing my hands and left. Way to wash your hands, Ben. Way to go, bud. You know, most guys don't wash their hands after using them. I know, Sarah, you hate to hear it, but it's true. That's been one of the real positive, Ben's like, can you please get back to my email? Hand sanitizer everywhere has been a very positive development since the pandemic because guys are hardwired. I know it's gross. And I know that girls think this is disgusting, but guys,
Gross is like grossly understating how gross it is.
well, gross is pretty gross. But I'm just saying, the good news here, the silver lining, is that hand sanitizer absolutely everywhere, I think, is having a positive impact, because I think more guys pump the hand sanitizer than ever before. Sam, you look cynical. Now, I know you to be a guy that washes his hands, though.
Well, I mean, that's just
Most
it. It's
times.
like, first of all, the bathrooms here have really nice smelling soap, so I'm just pointing that out.
Fabulous
So
soap.
I'm a big fan of the soap in our building.
Me too.
But it's also like I am hardwired to always wash my hands. Like that was beaten into me, not literally, like since I've been 2.
But
So
not
I don't-
everybody. You know as
Yeah.
well as I do, rock concerts, hockey games, people are trying to, because there's the big long lineups, and so you can only grab a beer or go pee. If you're a master of scheduling, you can oftentimes get a beer and fit in a pee in the same intermission. But sometimes that precludes people from taking the time to wash their hands. That is just a fact. They go on to use the pin pads at the ATM machines. They go on to touch door handles and doorknobs. I'm not trying to gross everybody out. This is just real talk.
It's just really funny because when you think of like, have you looked at the lineup for the women's washroom? Because you don't get to the beer lineup. You miss half of part of the show.
Yeah.
So cry me a river.
I'm not crying. I'm just telling you a fact. Whether you like it
It's
or
just
not,
facts,
most
Boyle.
guys don't wash their hands. But Ben does. And he says, you know what? Musicians are out there risking their lives for a few $100 just so we can enjoy ourselves and bring some enjoyment to other people's lives. And this is what we get in return? Berated in bathrooms for wearing masks, chirped at. He says, I don't know what to get from telling you the story, Jespo, except for that it's bad all over. That from Ben Plays Drums. Thanks for that, pal. I appreciate it. You can send us an email anytime to talk@ryanjesperson.com. Before we go, I wanted to give you a heads up that we have right now a new blog post up at granddog.ca for all the dog lovers here among the Real Talk community. Enough kibble. It was time to go raw. You can read the blog post at granddog.ca about one family's, look at that beautiful boxer puppy, one family's journey from kibble to raw, why they did it. You can tap into a whole bunch of great resources there, or talk to one of their talented staff members, nutritionists on staff with Grand Dog. They can explain to you why so many people are putting their dogs on that raw diet. They deliver to your door in Calgary, Edmonton, and Red Deer on a weekly basis. And if you use the promo code REALTALK, they'll take 10% off your first-time order at granddog.ca. Also, big shout-out to our friends at Kubi Energy. Of course, you know Kubi in the game of sustainable green energy. Net zero is the goal. And they're operating, of course, in Western Canada, most notably out of their Kamloops and Edmonton offices with Tesla-certified installers, finding solutions for people living right in the city centers or people way off the grid. They're experts in implementation, and with technology changing, advancing, and the price coming down, there's never been a better time to get in touch with the team at Kubi Energy at kubienergy.ca. Coming up tomorrow, our election coverage will continue. A conversation with Sherelle Evelyn from the Hill Times. And I am so excited to check in with Paralympian Caitlin Wright. She'll be our guest on tomorrow's edition of Real Talk. In the meantime, make it a great Wednesday, friends. One love. We'll talk to you soon.
They're gonna